Morning House Calls, sponsored by UK Healthcare.
And welcome back to Mountain News This Morning. We're being joined today by Dr. Claire Snell-Rude, who is with the postdoctoral scholar. She is a postdoctoral scholar with the Department of Behavioral Science at UK. Thanks for joining us.
Thank you.
And we're talking today about women's depression. And of course, I think we kind of hear about the depression in the general, but why is women's depression so important, especially here in Eastern Kentucky?
Well, women's depression is really important in part because it can be really hard to recognize as real. A lot of women think that what they feel is just a bad mood or it's something that they aren't trying hard enough. Many of the symptoms of depression really overlap with things that we might experience just when things are going badly, if we can't sleep well or we don't have the same appetite. But depression is a real illness, and if you end up having a number of symptoms of depression for about 2 weeks, then you could well have this as an illness. And it's very significant for women because it impacts their overall health and well-being. People who have depression are more likely to develop other illnesses. It's harder to sustain healthy behaviors. It's harder to have good performance at work and to take care of the people we love. So for all these reasons, depression is something that's very serious, even though it can feel hard to recognize because of its overlap.
And how does it manifest itself differently in women as opposed to men?
Women a lot of times end up ruminating a lot on their thoughts. They end up internalizing many of their feelings and not necessarily reaching out to help. Oftentimes because they feel ashamed or they feel that it's something that they should be able to work through on their own. Whereas men sometimes can act out a little bit more aggressively with their depressive symptoms than women.
Okay. Why is there so much depression in Eastern Kentucky?
That's a great question. We know that Kentucky actually has the second highest rate of depression in the entire U.S. But it's not just people in Kentucky overall. If you were to look at a map of Kentucky and all of the different counties within the Commonwealth, you see that people within southeastern Kentucky have almost twice as many poor mental health days as in central counties within the Commonwealth. And a lot of that is because depression, you're more likely to have depression when you live in an area with higher poverty and unemployment. So people here are more vulnerable to that, to depression just for that reason. It has nothing to do with anything other than those risk factors.
Okay, and that being said, what is it that women need to do, or men too, if they feel that they're suffering with these kinds of symptoms and they feel like they might need professional help?
Well, the first thing that you should do is you should reach out to your primary health care physician. These are people who are very familiar with depression, but they might not think to ask these questions on their own, just because a lot of times you might have another agenda when you go to their office. And they also might be a little bit shy to ask these questions because they can be personal. But if you have a feeling that you might have some of these symptoms, it might be something that's more sustained, then it's worth talking to them because they can tell you about treatment options, both medication or potentially being able to refer you to some type of psychologist. In addition, there's a couple other community resources in the area. There are community mental health providers, and we have a list of resources that are provided on the Center of Excellence in Rural Health website. In addition, this is a mental health provider shortage area, so that means there aren't nearly as many resources here as there should be. So what I'm doing is I'm working with a number of great colleagues at the Center of Excellence in Rural Health so that we can figure out ways to adapt existing interventions so that we can reach women here and address their very specific needs.
All right. Doctor, thanks for joining us, and we are back with more Mountain News This Morning.